Are you currently suffering from back pain that's aggravated with prolonged sitting but improves with movement? With these symptoms, people are often given the diagnosis of degenerative disc disease. And this is a very scary medical term that often makes people believe that their spine is wearing out. For those who don't know me, my name is Dr. Zach Great here at Performance Sport and Spine. And my whole mission and goal with this video is to help you understand what this condition is and what it isn't, and then how to exercise safely. So as we age, these discs change, and when they lose height, it places stress on our body a little different. So sometimes more stress is placed on the back part than the middle part, and this can cause degeneration and changes. This condition typically causes generalized back pain that's worse with prolonged sitting, better with movement, or laying down. And often with back pain, we think there's a singular structural flaw, like a muscle strain, or a facet joint, or a disc bulge. But back pain is multifactorial, and there's lots of factors that influence it, including aging, genetics, smoking, altered mechanical load, general health, and the immune system. And since this is caused by a multitude of factors, we find that there are studies where people that don't have back pain at all, they're completely asymptomatic. In their 30s, 20s, 50% of those people, so 1 in 2 will have degenerative disc disease and no back pain. And this increases as people get older. So people in their 70s, over 90%, so 9 out of 10 people that have degenerative disc disease don't have back pain. However, this can often frustrate people when they hear the statistics because they're like, well, who cares if they're not suffering from back pain? I had this condition, I'm suffering from back pain. And this study did find that people with degenerative disc disease do have a higher prevalence of back pain than people without. But the truth is, this condition doesn't cause back pain. It increases your likelihood to experience back pain. And joints are healthier when they're moving around than when they're sedentary. And later in the video, we'll talk about the threshold model to help understand this condition in a simple and effective way. Level 1, kneeling reach. In a kneeling position, we're going to practice bending forward. So we're going to reach forward with our hands, pressing our buttocks backwards, feel some gentle dull tension in our low back. Hold for a sec and then come up using your hips and buttocks. Again, reach farther forward, feeling some gentle tension in your low back and a good stretch in your muscles. Again, use your hips to bring you up, right? Level 2, we're going to use some light weights. So in a kneeling position, holding some light weights in each hand, we're going to sit back onto our buttocks, reaching down with our hands to the floor, and then sit up using our butt. Again, reach down with the floor with your arms, and then reach up with your hips. Level 3, ball squeeze. In a standing position with the medicine ball between your stomach and your arms, we're going to press down with our arms with our elbows straight, reach forward to the floor as far as you can to tolerance, and then stand up using your hips. Again, maintain pressure through the ball through the full range of motion and reach as far as you can, trying to increase the range of motion with each rep. Level 4, banded pullover. So anchor one band to the side and we're going to bend forward with our hands, pushing our buttocks back as far as you can, and then stand up using your buttocks, feeling tension in your butt and your back. Again, let the band pull you forward as you feel your back stretch and practice bending forward, and then stand up using your hips and buttocks. Banded bird dog. Put the band around one hand and the opposite foot. We're going to straighten one leg in the hand using your shoulders and your hip, keeping your back and pelvis in neutral. Return to the starting position and then press out. Hold for 2 or 3 seconds and increase over time. Again, make sure it's your shoulders and your hips, not your low back. Goblet weight box squat. Holding the light weight, we're going to sit down into a box or a step about 18 inches high and then stand up. Make sure to keep weight over your midfoot and use your legs to lift you up, not your back. You can slow down the tempo, remove the box, or increase the weight to increase the difficulty. Exercise ball plank. So with the ball on your forearms and you're up on your toes, we're going to engage our core and back. If this is too difficult initially, you can go onto your knees and then build up over time. And as you get stronger, you can progress to your toes. 2 ways to increase this is do the stir the pot. So in that plank position, we're going to stir our arms in a clockwise motion several times, keeping our core engaged, and then counterclockwise. Another option is a bone saw. So we're going to keep our core engaged as we push our arms up and back to make it more difficult. Farmer's walk. Holding 2 weights, we're going to walk down the hall or a path about 30 to 40 feet. Turn around, feeling tension in our back and shoulders, and then increase the distance and weight as tolerated. The threshold model means that when our stressors or loads, both internal and external, pass this squiggly line, we're going to experience pain. And when you see this green line here, or mild degenerative disc disease, there's a large buffer between the green line and the squiggly line. With the blue line, there's less of a buffer for moderate degenerative disc disease, and then the red line for severe is even smaller yet. And despite what people tell you, no exercise can change the green, blue, or red line. Good news is we can change the squiggly line and increase our threshold through such things as general and regular exercise, better sleep habits, better general health, stop smoking if you're smoking, improving your diet, eating more vegetables, healthy social interactions, and then more active stress management options. On the converse, being more sedentary, higher stress levels, poor relationships can decrease our threshold. So basically just being a better, healthier human give you a better chance of not experiencing back pain with this condition. We've been told often that stress in the joints is bad, but truthfully, stress in the joint is fundamental to the health of the joint, and we need to change the narrative. So we have a joint, and we apply stress to that joint, and that in turn causes the structures of the joint to adapt to withstand more stress, which in turn makes the joints healthier and they can do more. On the contrary, if we don't stress the joint, the structures of the joint don't adapt to withstand more stress, and over time they become deconditioned, and if you don't use it, you lose it.